Do I need the microphone or can everyone hear me?
Yeah, microphone.
Microphone?
Especially with the mask on.
I'll take the mask off, sorry. Is that better?
Yes, that's better.
Okay, thanks everybody for coming. I'd like to start by acknowledging the traditional owners of the land on which we meet tonight and pay my respects to their elders, past, present and emerging, and to any Aboriginal people who are here tonight. So, I think most of you probably know me, but just for anybody who doesn't, I'm a retired GP, used to work at Dover in the medical centre here, and I'm currently the chair or president, whatever you want to call it, of the South Huon Community Health Association. So, for anybody who wasn't at that previous meeting, so Jim talked about the meeting back in July, which I think there was a couple of hundred people at, and part of that meeting there was a decision that the community wanted a group set up to try and push forward progress with the medical centre and other sort of health related issues. So basically we went away and we've set up the association. So by way of introduction, so that association has become incorporated in the last couple of months, sort of after Christmas, and so we then formalised the committee, and I'll start by introducing who the committee is, just so you know who everyone is and what we do. So I'm currently the chair, the vice chair is Odette Lenane. You want to say anything? We're happy to just give everyone a
my
wave.
name's Odette Lenane. I've been in the Valley for 25 years and I'm an oyster farmer, but I'm also a lawyer for the federal government, so I'm here to help. So.
Thanks, Odette. Secretary is Dennis Bergman. Unfortunately, Dennis can't be with us tonight, but his role is secretary, and he's been around Dover for a long time with the shack and then moved here permanently and is pretty familiar with Dover. We have the treasurer is Mervyn Brooker.
I take all your money.
And public officer is Jen Hadaway.
Good evening everyone. Most of you will know me. I've been here for 18 years and involved in all sorts of things to do with the community. I'm available to any of you who want to talk to me, particularly about Dover and Geeston medical services.
We then have some other committee members, Tony Munnings, who also can't be here, he's unfortunately unwell. He's my partner, he's lived in Dover for, I think, forever actually, but he's pretty familiar with the area. We've got Fran Davis. Do you want to give everyone a wave? Rosemary Sanford.
I lived here in the 80s, I've been back 5 years. I've been a healthcare volunteer with a ward of the community for about 10. Thank you.
And Ellie Richardson.
Hi, I'm new to the area. My husband and I just moved to Strathblane a number of weeks ago. I'm a medical scientist. I've had 26 years in primary health. Recently, the last 4 years, the service director, looking after 9 general practices in rural areas across Western Queensland.
And so that's all the committee members. So the next issue was to talk about what we've done and where we're up to. Does anybody have any questions for any of the committee members first? No? Right. So since we became incorporated, which not that long ago, we've been, I think, fairly busy. We've written lots of letters and we've had a lot of contact with the council, and so I think things are progressing. One of the things I was hoping, and we asked the council to send someone to give us an update on the medical centre. Nobody was actually available. I think they would have come otherwise, but they have given us several updates and we're continuing to get updates. So I can give you, as I understand it, the update on what's going on. So, as you know, the grant was allocated in the state election, which was about 2 years ago, and then the tender process finally went out on the 23rd of December, so 2 days before Christmas. They had a closing date of the 23rd of January. 10 contractors looked at the tender documents, but nobody put in a bid. So the council then went back and they have approached all of those contractors to try and find out why they didn't put in a bid and whether there was anything they could do to encourage them to do so. They're still in that process now. So they have assured us they should have some news by the end of this month, which is next week. So we will be obviously asking for an update as to what's going on then. But that's currently where it's at. We still don't have a builder, don't have a start date. So we will be continuing to ask questions. We have got further meetings organised with the people who are doing that, which the medical services team from the council, as well as the mayor, the general manager, and some of the councillors. So we've got a meeting organised for the 31st of March, when they should have an update, because I did say by the end of the month, and there's a few of us who will be going to meet the mayor, the general manager, and the medical services team then. So hopefully we'll have more of an update then. Any questions about that? So, moving on. So the other thing that several of you would have been involved in the kitchen table conversations and the surveys that were done by Health Consumers Tasmania. There were people in the pharmacy and so on, and several of you probably would have been involved in that. So that's part of what's called a co-design project, which is a bit of a new buzzword. It's going on all over the country. It's not unique to Tasmania or Dover by any means. And it's being organised by Primary Health Tasmania in conjunction with Health Consumers Tasmania. So Health Consumers Tasmania did the consumer bit, and the co-design means that the consumers and the health service providers work together to design the future of healthcare, so that the healthcare that's provided is what actually works for both sides, both consumers and health service providers. So they did a survey of consumers, and they've also been in touch with health service providers in the Dover-Geeveston area, and they've put everything together to look at this co-design. So there was a big meeting at the Commandy Hotel. We had a pretty good turnout from Dover, from the consumer side, to get our voices heard. And that meeting was really to look at the areas that were identified as problems, and then they'll take that forward. So the four big areas which were identified by both consumers and health service providers, they actually all said pretty much the same thing, were communication, so communication about what services are available, what's going on with the medical centre and so on. That was one. Barriers to accessing healthcare was the next one. And those barriers may have been real or perceived. They included things like cost, actually getting appointments and so on. So that was number 2. Continuity of care was number 3, that people were worried about locums and this revolving door of doctors as they saw it, and wanted more continuity, attraction, retention of health professionals. And the other big one, number 4, was after-hours care. So after-hours care is probably something that may need to be something that we look at further. So, as many of you would know, there used to be an after-hours room at the multi-purpose centre that was very reasonably closed because of COVID and the fear of COVID getting into the aged care facility, which was totally reasonable. It hasn't reopened yet, and so it would be good to know what's exactly going on with that. I'm not sure where that's at the moment, but something we can perhaps pursue. So part of that co-design then going forward is there's actually a big 5-hour meeting tomorrow, which I'm really looking forward to, 5 hours, which is to actually progress things that were identified at the Commandy meeting as priority areas, and to look at actual actions to take those forward. So that's that section. Any questions about that? Jen?
I've just got one, Eve. Are people who have not registered for that meeting tomorrow still able to attend, do you know?
I don't know, it's not something I'm involved with the organisation of, but I would imagine if you rang them in the morning, I think they really wanted numbers for catering more than anything, but I think you could probably, have you got the details
Yes, I do.
Yeah. I bring them in the morning and
There's a QR code on the posters where you can register, so people get that.
But if they need to phone in the morning.
Yeah, the phone
Yeah.
numbers are all on the posters.
yeah, there was a closing date for registrations which is passed, but I should imagine if you rang them up, so wrote something.
I was just going to ask where these meetings were advertised, because I didn't come across them, but obviously there were posters.
I run the Bush Telegraph on her page on Facebook. I know they were shared there.
And I think
the kitchen table conversation part was quite widely advertised, and that was the beginning of the process. And then the commandy one was also quite widely publicised, I think, through various things. So it's hard to get everybody, but. Any other questions? So I guess the next part is about where we go from here and what the community and what you guys can do to help the process go forward. So one, obviously we're having the open forum shortly where, we encourage you, any concerns you've got, any issues you've got, we want to hear about them so that we can try and help. But also it would be great to have community input. So one, obviously, is becoming a member of this association. Moves over there with the receipt book. We don't have a bank account set up quite yet. We're in the process of doing that. So it's cash only at the moment, which is $20. But the more members we have, the more of a voice we have. If we go to the council and say we represent 20 people or we represent 100 people, there's a difference. So the more members we have, the more of a voice we have. So that's the first thing. Have asked for people's email addresses. Obviously you don't have to give that, but we would like to at some point start having like a newsletter of where we're going and what we're doing so that we can get the information out. Things like the meetings and so on, we can send out to people if we've got a list of people's email addresses. The other thing is in terms of what the community can do to actually help in terms of one of the things we've talked about is attracting, retaining, recruiting new health professionals, doctors, nurses and so on to the area. And obviously it's really important if you get them here to keep them here. One of the things that's been shown in studies, we have evidence that says if a local community makes that health professional feel welcome and valued by that community, they're more likely to stay. So we want them to feel welcome and we want them to feel valued. And a couple of the things we've talked about, and we want to hear your ideas too, but things like having a welcome, just a little sausage sizzle or a barbecue down at the beach, just so they can meet some local people and make them feel welcome. And the other thing is to put together a little package that we can give them when they arrive with a bit of information about the local community and activities, and also some vouchers to get them out into local businesses. A couple of people I've spoken to have talked about, donating meal vouchers for local venues, activity vouchers where they can take the family, and that's the sort of thing that would be great. So any local business owners that want to jump on board and look at donating, it doesn't have to be anything big, just something small to say, come and have a chat with us at our local business, we want you to feel welcome, and get on board with that. That would be great too.
Behind you. So if you've got ideas like that, you can put that.
The email address,
The question separately.
so the question was if you want to donate, if you're a local business owner, who do you get in touch with? So the South Huon Community Health at gmail.com is our email address, and that's something that we monitor, and if you've got any input, ideas you want to contribute, that's probably a good way to do it. Otherwise contact one of the committee, but that's a sort of central part that we monitor, and we can keep a record of everything that if people are donating and so on, which is probably the easiest way. Any questions on that?
It's not an address, they're literally challenged.
Try getting an email address on Gmail that someone else hasn't already got. More questions?
Thanks, Eve. Just want to underline the importance of what Eve said about getting behind the association. If you had 200 people all joining and were members, you're telling the government, at local government, at state government, at federal government level, this is important to you. My experience from July last year, when there were more than 200 people in the room, suggests overwhelmingly that it is important to you as a community. If you get behind these people in the association, rather than looking at them as somebody else doing stuff on your behalf, it's actually you as a group, doing stuff to make things happen for yourself. And that's a critically important thing when you know already from the news that there's a critical shortage of GPs all across regional Australia. There's a critical shortage of really good healthcare all across regional Australia. So how do you get attention? You get better organised than the rest of rural Australia. That's the answer. And I think the very fact that since only 8 months ago, there's something being organised and it's doing something on your behalf suggests that you should get behind it. I really do encourage that, because it's the thing that will get the most attention from the bureaucrats who are getting requested to do all sorts of things from all over the place. How do you get yourself heard? Get organised. That's the answer. Now, this is the part of the...
Can I ask?
Yes, you may have a question.
Who in this room doesn't want to have a doctor in donor?
They wouldn't be here. Sure.
He doesn't understand. Who doesn't want a doctor in donor to look after all our needs? Even the people you don't like who live in donor want a doctor. So I can't see what the bloody problem is. Just come up, how much is it? I'm deaf.
$20, lads. 20 per annum. Per person.
People can't just whack out $20 is bloody nothing these days. Inflation going
4 cups of coffee,
the price has not gone up. You might have to put it up 25 soon because of inflation. But everybody should be in it. I don't see what the problem. We can then use money to hire people to do things that we're not capable of doing. How to deal with bureaucracy. There's all these things that need professional attention. And if, for the sake of $20, if you're not prepared to put it up, we might as well go home now.
Okay, well let me put it another way. Is there a problem with people joining? I'm not aware that there is a problem.
There is.
Well, could you stand up to the microphone so and explain what that answer is?
Well, no, I won't stand up, but just, I mean,
I want everyone to
the
hear.
first meeting, and the expectation was you brought a card or you had some money, not to a card, you could pay up and become a member then. It was $10. I had no idea that there was a membership take. I would have gladly bought $10 and give it.
It's
I
not too
bought
late.
$10 tonight and now it's $20.
Well, you can put down a down payment.
Well, it's been done.
In other words,
But some people on a bread line will struggle. They will.
yeah, okay, I hear you.
I'll say something.
But we've got a lady here with a question, but
But just
Yeah.
on that,
yes.
so I'm Jane.
Sorry.
I was part of the steering committee originally, and for personal reasons I had to sort of pull back on it. But I actually didn't join the association then because my take on it was that I wanted to wait until things got moving, the incorporation happened. And I think with that now, overall, it would be helpful if people got the idea that the committee's actually, or the association is formed now, if that's put out there a bit more, and that people let people know that it'll be more organised and sort of, from here on in it'll sort of get more legs and get moving. And so I'll be joining tonight, although it'll have to be an IOU move, so you can bring my purse. But I still want to be involved with the association in some way, and where I could probably be better utilised as well as with fundraising and organising things and using my equipment and, you know, things like that. But the people that are here tonight, we're all here because we are interested tonight. It's the people that aren't here tonight and the numbers that have sort of dwindled from the first meetings last year, which obviously the big meeting last year, everybody was like, what's going on with the medical centre? So now it's probably time to, with the association being formed and getting up and running, is to attract those people back again somehow. So.
We're going to hold that thought because that's something I wanted to talk about. But
and it was always $20 a month.
Before I let you speak up, there's a lady, please. You've got something to say.
I was just pretty much
Would you come up and boom it, stand up and boom
I
it
was
out?
only going to say what Jane said. Kerry just come up with a brilliant idea, which was pretty much what Jane just said, that we sell raffle tickets, let's sit down there and say we need people to join. If you promote it, you know, like a promotion, like Jane said.
Okay, so we had the same thing said in two different ways.
One of the big tasks is figuring out how to get people to join. Because the beneficiaries are everywhere. What's the size of the population in Dover? 1,000. What's the size of the population in Geeston?
Probably
100? I'm guessing.
More.
Yeah. Similar? So you're talking about more than 2,000 people, and I presume that includes children.
Yeah.
So of the adult population, 200 people who are members of the association isn't that big an ask. Okay, man?
I was just wondering...
It might be easy to stand up and face people rather than me.
Not knowing where to go to join when I can't join tonight. If you had a table in a diver, something like that, in a couple of different spots, every, once a week or something, then if I'm passing, I can go in and join.
Okay, Eve's got a response to that. Come back to you, sir.
Can I just say, that's a great idea. It's a great idea. We need people to man it though, which means we need people's help. I can't sit there every week, neither can anybody else. So we need people to actually get involved and come and help us, because we can't sit there every week or whenever, we just need help to do that. So tell all your friends and so on, but yes, that's a great idea.
And you couldn't have done anything without being associated anyway, could you? So that only just happened.
Perhaps one of the committee members could coordinate a program, whether it's going to be, I'm sorry, I didn't hear where you said we should let people know. Where does everybody go? The pharmacy? Is it the pharmacy where we go? Can you do it with the pharmacy in conjunction with them, or the petrol station, or the supermarket, or whatever? If you have one of your committee, if you have one of your committee coordinate the volunteers. So the first thing is to get something happening so that you can, at least for a few hours of the busy time each day, encounter people and tell them this is what it's about. Give them a bit of background on it. Ask them to consider spending $20 to be part of it as the beneficiaries of what it's going to do and what it's already doing. But you need to get it coordinated, because as Eve's just told you, she can't be there all day, and no one should be expected to sit there all day. But if you were to give yourself an hour, I can do it for half an hour between such and such, or I can do this like that, but you need someone to coordinate that. That's what your committee's for. I suggest that that's the way to go. Ma'am?
If you're going to do a membership drive, it might be very helpful to have a brief pamphlet or flyer that outlines
you need to give people
what
something.
This is about.
Yes.
So that they've got, something to think about. They might
Correct.
not join straight away, but, just say
something that says, this is what it's about, this is what we're doing, this is what the benefits are going to be to you as a member of the community. You've definitely got to hand something out.
Yeah.
Otherwise people say, what am I giving my $20 to? Unless you've got a big, bold website that explains it all. But yes, you've got to have something to give people, but it's got to be a coordinated effort.
Yeah.
I think it's doable. So, Can you turn around and talk to me if you're reluctant to use the mic?
I don't want to leave you what you've had though. I was just going to say that there's probably more people that would have been here. I've got 2 apologies, but there's nowhere registered apologies. And I'm sure other people are here and have got apologies too, so we shouldn't be
too hard.
We're shrinking all the time.
Okay, my response to that is there was a piece of paper to write your name on as you came in the door. I am sure between now and when everybody leaves, there'll be a piece of paper ready for you to write the names or contact details of the people that the committee can now come approach, because we don't want to let anyone through the cracks. That's the whole point, isn't it? I think that's right. Yeah, okay, well, that's great. More action for the South Huon Community Health Association. I'm still getting that acronym. It's great. It's great. Now we have another suggestion, ma'am.
I just thought...
Would you stand up and talk to the group, because I can hear you, but they may not.
I attended the Seafest this weekend just gone, and there was somebody collecting money for the soccer. There was buy a brick for $100 for the sailing club. That was all organised, and which we were able, because we've been wondering where to give the money, the donation to the sailing club. So why not incorporate something for the Diver Regatta that's coming up in April? If we can get some volunteers and we can sit for an hour and collect the $20 for new members.
Excellent. There's another suggestion for whoever's going to coordinate this. I hope somebody's making a note about it, please. The Diver Regatta's coming up. That brings people out. And the thing to think about is, where do people congregate as part of that event? That's where you want to focus somebody with a table or with a sandwich board or something for a few hours. You've got to grab every opportunity, and thank you. That's an opportunity you've identified. Are there any other issues that people want to raise, or has anyone got other questions about some of the things that Eve spoke about? Or is there something else that you want this new associations committee to give attention to that hasn't been covered? Can I ask, last year I got very interested in the idea that there's going to be a helipad. Am I raising something stupid, or?
There actually was,
a helipad?
no, but they're suggesting at Commandy, when I was there, they said that they're going to ask the council to give
I don't think anyone can hear you, Matt, but I'm asking you're back to most of the audience.
It's a bit hard for me to do that.
You're good enough to come up to the microphone.
Hang on. Well, when we were at the Commandy Hotel with the co-design, we were asked about the helipad, and they said that they're going to request council releases the plans for it, because it's only been... Huh?
Look at
the
audience, not me.
No, so what they said was that they're going to request from council to give the plans for the helipad a public sort of showing. So hopefully we'll be able to get something like that from the council, because at the moment it's just rumours. People have spotted people surveying places, leaving pegs, not talking to them about what's going there. So we just want to know if it's going to go where they say it's going to go, but who says it's going to go there. So there was actually a bit of a request and that it was going to be put to council that the plans be made public, so that people can have a good look at them and give feedback, although we're hoping that was going to happen anyway. So that was the last thing.
Thank you. Sounds to me like that's something that people want who are going to the meeting tomorrow. That's something for you to talk about at that meeting. Would I be correct in making that assumption? Now, before I ask you, ma'am, because you had an opportunity to speak already, anyone who hasn't spoken yet, I want to give you a chance to say something if you feel inclined. Adette.
Hi everyone, thanks for coming. Can everyone hear me? Okay, so one thing that has come out of what we've been doing is we've been going to council meetings, 2 or 3 members, three of us went last month, and we've been putting to council questions particularly for the purpose of driving at least the work that's to be done in the centre here in Dover. We've been starting to coordinate that with questions that we want to put to council that are specific about when this is going to happen, when it's going to get started, and we noticed a dramatic change in their attitude towards us now that we've formed a group. To the extent that they actually came down, did we get 2 or 3? We got 3 members of council that came down to our last committee meeting. So that's a long, long way from where we were before we formed, where the council were refusing to discuss the matter with us. So that's a lot of progress in a short period of time. So I'm urging you to write down this enormous email address here and send us questions that you would like to be put to council about where that build is at or how it's progressing, and we are already starting to have an organised campaign with putting these questions to council, and we're getting a response. So I just wanted to let you all know that.
Thank you.
No, thanks.
Can I add to that?
Yes,
Can I add to speak, please?
I won't ask you to stand, but use your biggest voice.
Just what I did was said, if people want to go to council, I'm happy to drive you and help you with your questions. It'd be far better if you come with me and ask questions than if I go and ask questions.
Spoken like a true fox terrier. Find a foxhole once you be down there afterwards. Okay, Matt, you had a comment you wanted to make, please. Would you mind coming out into the microphone? It's so much easier for everyone to hear. I know it's something not many people are used to.
It's probably easier if you just take a photo of the email address and find it, things like that. Hi, my name's Kathy Packham. I'm from down South Port. My question is actually to Eve, if you have any idea. Once this work starts at the medical centre, is it going to affect the ambulance entry?
Is it?
I can't specifically answer. I don't believe it's going to impact on the ambulance ability to get to the medical centre, because obviously it's critical that
to get the Dover one in and out.
No, it shouldn't, because the actual footprint isn't changing.
Right.
If I may, I have nothing to do with the people who are going to build it, but I can assure you all the plans won't actually change the footprint of the building and the size. The changes will only affect what's within the building, the interior, because as you know, we have a health centre with lots of room, but no rooms, and what we want is a building with lots of rooms for people to work and get their treatment in. So the answer is no change to
What
the
about during the actual build? When they're working, will they have anything barred off or anything?
No, the access to the ambulance will not change.
Okay.
And that's me telling you from what I've seen of plans, but I'm not involved in the actual doing of it.
I think there's certainly
It's just, that we're giving it out.
Okay, that's good to know. Southport will be well informed about ambulance access. And these are the things that this forum is about. This is an opportunity for you as members of the community to say, this is bothering me, or I have a concern that somebody I know is going to have this need. Now's the time to bring it forward, as well as what we've already talked about, of course, in the fact that everyone needs to join the association. Did I see a hand waving at the back somewhere?
I only have any thumbs up, so here.
Oh, good, you're agreeing with me. Thank you, sir. Ma'am, if you come forward, please. You're one of the committee, aren't you?
Rosemary.
Rose? Is it Rose? Rose.
Can you hear me, or would you like me to go to the microphone? Can you hear? Okay.
Thumbs up. You've got a bit of strong voice.
Okay. Two things that have come to my attention, which, as a member of the committee, I'd be interested to hear more about. What are the issues facing people here, particularly elderly people, people who have been discharged from hospital, be it the Royal or Hobart Private, I've certainly been talking to people who have problems with after-hours care, which I'll let Eve and others address. But my concerns have been related to people who've been discharged from Hobart Private essentially prematurely, given the level of care that is not available for post-surgical patients in Nova. Physio, home support, carers, qualified carers who can help particularly with elderly and disabled people. Another discharge from the Royal Post-Surgical recently for orthopaedic hip and knee problems that I've been told about. She's come home, there's no support here, she has an elderly husband who's trying to help her manage. She needs a wheelchair, she needs walking frames and physio. They gave her a list of exercises she had to do on her own at home. And that's there's just no post-discharge planning. On one occasion, a nurse practitioner here that I'm very familiar with, she rang Hobart Private and said, this person is disabled and needs this form of care when he comes home. Can you call him and help organise it? He never got a call from Hobart Private discharge nurse, whoever, or planner, whoever it was. So the post-surgical discharge follow-up is zilch in here, and particularly physio support, which is badly needed for people who've had hips, knees, etc. done. So as a committee member, I'd like to hear what other issues are affecting people here tonight, other people you know, family members, anyone from, South Port, Broome River through to South Hill, South through to Commanding. Thanks.
Is it okay then if I say, Rose, if you've got something specific to what Rose has just said, send your email to southhuoncommunityhealth@gmail.com. Please pass on to Rose.
Yeah, Rosemary.
After that, so because whoever is reading the emails will know where to steer the bits of information. Is that fair enough? Because rather than hand out stacks
people are uncomfortable with email and don't have access to email or just don't like that form of communication, I'm happy for my phone number to be passed on, and if you see Jen or Eve, I'm happy for you to have my number.
Thanks, Rose. That's great. Hopefully everybody understands it and can pass it on to others in the community. Now, there was another hand. Sir, if you wouldn't mind.
Suggestion to the committee
If you're going to stay there, would you mind just going to the edge of the group, then you can turn around and face everybody. There's a much better chance they'll be able to hear your voice.
So, John.
Thank you.
Well, suggestion to the committee has got to see the council. You had 10 interests in the tenders. No one put anything forward. The reason they haven't put it forward is they don't know what's going to happen in the future, whether they can get material or whether the costs will go up and they'll be landed in court. So when you're having the discussions, there needs to be some system of for the people that want a tender to be able to have these safeguards of getting it through without being caught and losing their money.
Yeah. That's all pretty clear and logical. I shudder to think that there isn't logic in the process of government tenders, but my own bitter experience of them is that 3 days it doesn't always work.
Yeah, exactly.
Sir.
So, just down the back, you just on John's comment there about.
I don't think people are going to hear you if
Hello, Gary.
it's only a short walk.
Microphones aren't that scary, come on now.
It was just to say that John's point there about finding a builder contractor. Mayor Sally Doyle was on the ABC radio only a few days ago, and she said that any quote that was put in had safeguards in case of price increases or the lack of availability of products. So that was actually brought up with Leon Compton on the ABC shows just the other day. So she said there was a contingency built into the funding that would cover increases in costs. I mean, that's what she said.
Yeah.
I mean, I can't. I just have to hear that to kind of half answer John's point.
And it's good to have that feedback.
Yeah.
The important thing is, though, that Eve has already said to you that the new association committee is going to be in regular contact with council, and council is committed to give regular feedback. So the whole process of why the tenderers didn't actually, or the people who expressed interest didn't actually lodge a tender is we're going to learn the answer to that. I think we can count on our committee coming up with the reasons why and have better understanding of that, and hopefully that will result in somebody actually putting a tender together. Please, yeah, just take a nice.
If I can just clarify that slightly, I think what Gary is mentioning, because a question was asked of council that the $1 million was granted 2 years ago on the cost, what they thought the project would be 2 years ago. Now obviously building materials and costs have gone up very significantly in the last 2 years, and the question was asked as to whether the $1 million is still going to cover the project in the form it was originally planned to be. And what they have said is that they've put enough contingency in for that. Now that, I don't know if that covers future increases in costs, as you say, or that's just how they're looking at it now. And I don't think they have any quotes yet, but that was to do with the last 2 years, not necessarily the next bit before they actually get it built. So it's a little bit hard to see how that they would have that much of a contingency built in, but they're assuring us that they have.
Most important thing is obviously they get on with it.
Yes.
It's what everybody wants. So we've got an association and a committee that are pressing for it. So I think we've made some good steps. And
I think one good reason why they didn't get tenders is because it was put to the when the tenders went, was it mid-December, and they had to be in by mid-January or even earlier than that. So who at that time of the year, with Christmas and New Year, if you've got to make such a big commitment to a tender, they didn't have time really. So of all the times that they had to do that, they had to pick those dates.
yeah, there's no logic to that, because we all know that the building industry always takes January on holidays, starting in the week before Christmas. So that's probably the most logical explanation. The reality is, though, that rather than speculate about why, perhaps we just support our association committee to get to the bottom of not so much why, but is there anybody who's willing to put together a tender, and how can we encourage that to happen sooner rather than later? Because what you really want is the work to get underway, as opposed to the fact that, yes, in all reality, council probably stuck up by putting the tenders out at the wrong time of year. But put that to one side. What do we want now? And that is some action as soon as possible. So that's the thing to support and get behind as far as tomorrow's meeting and other interaction with council that the committee has from here down the track. Dr. Patrick.
I just thought I might say a few things on a very positive note. I know that something happened last year that made people feel a bit anxious, and hence the meeting happened. But the power of what you've done is amazing, so that since that happened last year, we've had a merger of the two practices, so that we now have one practice, two sites. And you'd all say, well, of course you'd have one practice, two sites. But it took 5 years for that to happen. And it happened because you people came out and said, this is crazy, do something about it. Likewise, the building in Dover is happening because of you. 3 years, I think, not 2, we've been promised it's going to happen, and the money was set aside, and it was going to be manana. Manana only changed when you guys said we've had enough. So I'm very positive about what's happening, but it will only keep happening if you continue to push it. And so please, all your friends and relatives and people who died maybe 10 years ago, get them on that list, get them to pay their $20 and get as many as you can. Because unfortunately, there is still this notion that if we have a doctor, we're fine. And I hate to tell you that's not true, okay? Because it's not the doctor that's going to save you. There's no Jesus Christ saviors anymore. I hate to say this, okay? What you need are services. And it's the services you have to push for. The services that you get in other places, they won't listen to me. They will listen to me a little bit. And they listen to Eve, and they listen to the nursing staff, and they listen to pharmacy. But the people they really listen to is you, and you need to demand the services that you want. And I agree, you've got to tell Eve, the other committee members, what are the services that you need. Now, don't ask for everything because you're not going to get it, okay? But the very important ones, all right? And if you can do that, I think that'll make a huge difference. Thank you. I'll sit down and be quiet.
I'm not sure how much people know about the co-design workshop tomorrow.
Maybe
if
you've
people
got
are
something to
interested,
share, it'd
yeah,
be great to come up and then everybody will clearly informed.
Okay,
You want the microphone? Come on.
I've got a teacher voice, so I should be
Well, let's
alright.
hear your teacher voice.
In the back there. The co-design processes were two different kind of strands of the same thing. One was around the Dover and the Geeston Medical Centre, so a very local situation, and there were others that were more general for the Huon Valley. The meeting tomorrow, the co-design workshop tomorrow, is to vote on ideas that were put forth across the valley. There is a bucket of money to be spent to move some of these ideas forward. So if you haven't registered and you think you would like to go and have a say in that, it may be possible. I can't guarantee it at this point, but I do know that there's a generous compensation for your time that's been budgeted for as well. So you won't go up and be out of pocket for your petrol or your time. So
They're also providing lunch.
yeah, that you get well fed, but I hesitate to say out loud, but Sheridan did tell me that people who attend would get a $100 reimbursement for the 5 hours. So it's very generous for community members to have that. Don't go to try and get $100 though, because you might.
No, definitely get the $100. You can put 20 of it into join. and you can pay for somebody else to join as well, and still have $60 left.
But go with a passion to get some money spent on real services for people in the valley and have your say about what's really important. So, it may be too late. I don't know.
One can only ask.
That's
Yes.
it. So ring.
Yes, actually, I didn't register for the last one. I thought I had, and I hadn't. And I turned up, and then they took us on board, and there were still empty seats. So even though people register, sometimes they don't turn up, and that monetary amount is not generally known. A little bird told me only a day or so ago. So I'll leave that with you. If you want to talk to me about it afterwards, I'm happy to.
What time?
So it's
9:30 to 2:30 tomorrow at the RSL.
Bowls Club.
The RSL wasn't the
Bowls
Bowls
Club in Huonville. 9:30 to 2:30. So yeah, I will be turn up and see what happens.
Yeah. Okay. Thank you.
Thank you. What an incentive. What an incentive to get things going and get paid for it. Unbelievable. Is there anyone else who wishes to make a contribution, ask a question, show us something that hasn't been addressed that you think is a burning issue? Now's the time.
I might just say something else about the...
Yes, sir. You know how to use a microphone?
So, just going back to the organising of and trying to get people to meetings and things. So, I didn't know about this meeting until I was contacted about using the sound, which is fine. And then I saw the notices up at the shopping centre only. But I was just wondering, like with the other meetings when people signed in with their emails and so on, is there any sort of email list that you guys put together so you can send a group email out to everybody?
Secretary.
So when we had the initial meeting, most people left their mobile numbers but not email addresses, and obviously it's pretty hard to text a whole lot of people. So Merv did a sterling job ringing lots and lots of people for the first one. But since then, we've been encouraging people to try and give us their email addresses, and I now have a list of those that we have email addresses for, so that I can send the information out. But on the list, as you came in through the door, there is a section to put your email address. If you can, actually, I didn't think to put on it whether you're a member or not, because obviously the information that goes to members may not be the same as what goes to non-members. So there are some meetings that are primarily just for members, and there are some that are public meetings. But if you can give us your email address, then we can get information much more easily to you with just a click of one button rather than trying to do too much up there.
So just, that's probably a tech issue, so if you've got people or somebody that you need to help with text, so you can actually do group text messages as well. It's one message, send it off to a whole bunch, just the same as emails. So whether you need...
I think it's going to be sort of easy to have one system, but if people have trouble with emails, Colleen at the online centre will always help people if they need assistance with emails and that sort of thing, so don't be frightened to go and see Colleen, otherwise she's super helpful.
Is there a hairdresser down here?
Yes.
You might need one.
Well, I have heard that the hairdresser is the place to get information out.
Yeah.
Because the hairdressers know about everything that's going on.
Yes, we have.
You get your hairdresser on side and away you go. Just saying.
Hiring the hairdressers, don't we?
We've actually tapped into with that resource and given her a brief, and she gives the spiel to her clients. So yes, that's very good.
Yes, don't need a hairdresser, but I heard they're pretty good. Okay, Jen, you have something else you wish to bring forward?
I'd just like to add to what Rose said earlier. I'm available by email. I put it out a number of times, my own email. I put it out a number of times across the town. I'm happy to do it again, and by phone. To anybody who would like to contact me, I'm always available. I'm prepared to come and meet, small group meetings. I'm prepared to go to businesses. I'm prepared to run anything at all that you would like me to run in association with what goes on here.
I'm getting the feeling that because I'm in the interest of buying land at the moment for a whole lot of reasons, but this sounds to me like it could be a good place to come and grow old. If the community gets its act together as an association and gets things working together for each other, for the good of everybody, what a beautiful, attractive place to come and live. And that's what people say. The people who live here say that. But it's those same people who live here who've got this huge challenge of not sufficient after-surgery care, as an example. And, what happens to somebody who has a hip or a knee operation and then need special physio for weeks afterward? I mean, to me, the idea of traipsing all the way up to town just to get physio support is madness. And I can't see how there's any other logical way to get this happening here other than working together, being there. You've heard from people, individuals saying, people can contact me, people can get in touch with me. Here's an email, here's a way to send out multiple text messages. So it sounds to me like the committee will appoint probably a communications officer. I don't know, you may have already flagged or identified somebody for that role. But this seems to me to be one of the really big things, and it addresses one of the 4 things that came out of the co-planning issue of communication. Who do I talk to get information about what's going on? Who do I talk to get my voice heard about what's important to me? Who do I talk to when I can't get in to the medical centre for whatever reason? And this idea of the association, to me, is the most logical step that the community could possibly take to stand up and make it happen for yourselves. No argument was the stern reply. And therefore, let's take another step. Are there any other questions or comments or contributions that people want to bring forward to the group? Sir, I haven't heard from you before. Could you please stand up and use your biggest voice to boom into people's ears, or come forward? I don't mind.
Are we getting any help from Tassal, Huon Agriculture, those sort of people, financially?
No.
I would venture to say yes and no. The answer would be no if Tassal or Huon Agriculture don't get an approach that is easy to walk away from. But I'd say the answer would be yes if they get a coordinated approach from the entire community saying, you're part of this community, you are going to have people who are going to need services from the medical centre, quite potentially. Industrial accidents unfortunately do happen. So they, if they want to be good corporate citizens, will listen to a voice that's coordinated and united. How can they not do that? So that'd be my response. I don't know if you have something you want to add to that,
When you say we, do you mean the association, the medical centre, or who are you suggesting would be getting the funding?
I would say the medical centre, because they have a lot of people who injure themselves and should go to a medical centre close to. I mean, they could even put in an X-ray here for minor injuries like that.
That's a slightly trickier situation, but yes, I get your drift that they could certainly put some funding in that. Patrick might want to address it.
Look, surprise, surprise, I did write to a couple of well-known fish farming companies last year, mentioning a similar thing, that maybe they might be interested. But of course, you're quite right. In response to me as an individual, it's not their role, their businesses, they're making money. But you're quite right, Jim. And again, I stress, if you say to whatever company it might be, and it doesn't have to be a fish farming company, you're a part of the community and what can you do, I believe you'll get a totally different response. The response to me is, I've got a vested interest, it's not their role. But to you, it'll be different. Thank you, Jim.
Yes.
Just want everyone to be aware that we're not just forming this group to satisfy the need that urgent need that we currently have to address the medical centre in Dover. What we're trying to do is put together a really good organisation that will also be able to go forth and get funding for projects, and whether it's orthopaedic services or a dietitian or whatever other needs you come up with. We might all need a podiatrist one day, and we clearly don't have a regular service there. So when we are in a position to say, okay, what's our next project? What's the next most important thing on our list that the community has given us? Then we can say, okay, it's a podiatrist. So then we can go to businesses, whether they're fish farms or whatever they are in the area, and say, well, whether it's after hours service or what service they may use the most, would you like to contribute, and do you think you ought to contribute, given that you're a user, to this project that we now need to fund? So there's opportunities to find funding, not just at state or federal government level or local government level, but also within business of the community, to fund the things that we have as a priority that you've given us, that's about your needs. So, and we've got a list of those now, so that's developing. That's our purpose in the long run.
Thanks for that, and thank you, sir, because one of the most compelling things is if you can leverage $1 from the government by donating or getting a contribution of $1 from industry, or even better, leverage $2 out of the government, or even better still, get 2 out of the state government and another 2 out of the feds, all of a sudden you've got the power that you need, and the power is in the group. The bigger that community group, the more representative it is and the stronger you actually are because of what you can achieve. I was only reading this morning's news about a little town in New South Wales that decided to do, beg your pardon, yeah, southern New South Wales, down near Bega. They decided to do something themselves about the housing crisis and the homeless people because the council, the state government, the federal government all acknowledged that there's a housing problem but weren't doing anything for the people who are on the streets. So they started as a community and they gathered momentum and they got support from the local businesses and they got enough money together to build the first 12 little cabins, and then they went to the state government and went kapow. And of course, in New South Wales, the state government are facing an election next weekend, so of course you imagine what they were able to leverage at that time. And that's my point. You get started, you get organised, you get the community as a whole together, and you can really get things rocking when it comes to being heard and being listened to by businesses, corporations, the government, and so on. Don't forget the bank down here, it's Bendigo, I think, isn't it? Don't forget them either, they're another big player, and they're bigger than they used to be. So. Yes?
Just something I'm thinking of too is like, well, just sort of clarifying, is is it a priority now that you want more committee members or more members of the association?
More members.
So the more members there are, the more people are going to get out there and be supportive for the fundraising for the services that we want, and to be able to have the input into saying we want these services. So that's sort of just something that I'm surprisingly just clarifying myself in my head now.
We need more.
Yes, we definitely need more members, and I think the other thing is to say that, you know, all these projects, all these things we want to do, there are only 8 people on the committee. You know, we can't do all of it, so we need members, and if you've got skills, we've had Linda doing a fantastic job on the Facebook page, which has been really helpful because I couldn't have done it. So people who want to help, want to contribute, we need other people to actually step up and do stuff as well. Yes, become a member. Whether you can or can't do anything, that's great. But if you can do something to help, that's even better.
I would paraphrase that as the bigger your membership, the stronger your voice. It's simple as that. Now, we've been here now for an hour and a quarter almost. It's going to be time to say wind up unless we've got some other issues, because we're not going to just sit here and listen to me. That's not part of the agenda at all.
That's getting now.
Therefore, are there any more comments, any more questions, any more issues that haven't been raised or addressed already? Yeah.
We have the Facebook page put up on there so we know where to join on Facebook. I'm not a member on Facebook.
It's on the, sorry, I couldn't.
Oh, yeah, well, I know
it's really long, but it's on the bottom. There's one over there, one
Thank
with
you.
2 on the table. If you just go on Facebook and put South Huon Community Health, it'll come up.
Or take a photo of one of the flyers.
Yeah, oh, that's right. I'll join up forward.
Good point though. Some people love Facebook. So I suppose that's going to work for some people. Any way you can keep in touch. Make contact, communicate. The word community and the word communicate have the same Latin root. Just ask our learned doctors. They have to study Latin, those poor.
Well, that's Latin roots.
Community, communicate. Makes so much sense. Any other points? Any other things to conclude?
Just while we're talking about the Facebook page, the co-design meeting thing flyer is on the Facebook page. So anybody who wants to go to that meeting tomorrow, it is on the Facebook page of how to get to it.
They can do it tonight. Okay. Marty. People are joining up as we speak, ladies and gentlemen. This is exciting.
Really a question to the committee at this point in time. I was made aware of a proposal for a helipad in this town which adds quite
significant consequences for aged care, for the swift parrot habitat, and for neighbouring properties. I don't know where the proposal came from, but it was funded, and I'm just wondering, it's a fraught thing. I've had correspondence with council over the last 6 months and with state development, who actually took on the project, but they've all gone very quiet. Council claimed they didn't know anything about it.
No, they never do.
So I'm just wondering what the committee's feeling is. There is a bit of cloak and dagger thing happening with this particular project. It's not like the medical centre stuff, which was discussed. This snuck in somewhere, and I'm not quite sure why and how, and
you're going to investigate?
what the reaction is. The helipad. Because I believe there's
I don't have any information about where the helipad is at now. Possibly a question we can ask. I don't have any information.
Yeah, that might be worth bringing up at the co-design tomorrow, because it was mentioned at the other one in Commandy. I think that might get a mention. Bloody mouth.
The technology with helicopters and drones, think of a drone at that end, a helicopter at that end, the technology is going like this. I mean, they'll come and pick up a person who needs acute care with a drone. Sometime down the track, you can bet on that. But the point I'm making is that it's a good question, because there's no reason why, just because of where you choose to live, that you shouldn't have the benefit of the way the technology is moving. So you've got to keep, I like the expression poking the bear. The bear in this case is you and Valley Council to start with. Keep poking the bear and keep saying, what's happening? We've got this expectation that something's going to happen. Tell us what it is. We've got an association, we've got a committee, keep them informed, they communicate with us. It's all potentially doable, but only if you work together, it seems to me.
Well, I'm not against the helipad.
No.
Yeah, you just want to know where it is.
Swift parrots have to have somewhere to put their nest.
So aged care. Yeah, we don't pull down and then we'll do it.
So I think that's probably an issue for another time to discuss about helipads where they go.
Probably is. Probably can't go any further with this.
Yeah, exactly, Martin.
Are there any other final issues before we conclude? Because I think we're pretty much there, aren't we? Yeah. Sorry, one final thing, sir, before we go.
You get groups like the Men's Centre, Bowls Club, and all the different associations around to try and get members. You'll need receipt books sent out. You mentioned earlier about people not wanting to pay, but I think people will want a receipt.
Of course.
Over there.
Of course. And I think that the committee ought to hear the message that you go and approach the men's shed, go and approach the Bowls Club, go and approach the whatever club that's down here as another way of reaching out to potential members. Go with the receipt book, go with the little instruction pamphlet that we talked about earlier. It's going to help increase the awareness in the community of what is available to give you a strong as possible voice as you can. Yeah, good idea. Thanks for the suggestion. Now, I think we're going to close. Well, before you do, I want to ask everybody to join me in thanking you, Lee, because you had the biggest talk tonight. And you for someone who's supposed to be a retired doctor, she doesn't appear to be.
She doesn't know how to retire.
I think you're lucky to have her, so yeah.
She'd love it. So I just wanted to say thanks very much, everybody, for coming. I think the final thing, which is a Rural Doctors Association saying, is your healthcare shouldn't be dependent on your postcode.
No.
So everyone's entitled to the same level of healthcare no matter where they live. And I think that's just an important principle to take home.
Thank you. Yeah, thank you.
Thank you, ladies and gentlemen.